Welcome to Roots and Resilience. I'm Dr. Tejal.
And I'm Dr. Nehal. We have had some incredible conversations with inspiring individuals that we feel compelled to share with you all.
Listen with an open mind and an open heart. You never know, you might just pick up a pearl that might spark something in you.
Enjoy. Welcome, listeners. So, today's guest is Dr. Hoda Wassif, an associate professor and portfolio lead for postgraduate health education at the School of Nursing, Midwifery, and Health Education at University of Bedfordshire. Dr. Hoda Wassif holds a PhD and two master's degrees. With over 20 years in academia, her research explores ethical practice and creative approaches in qualitative research, particularly in health and dental education. A published author and active mentor, Dr. Wassif also serves on editorial boards and ethics committees, and she has been recognised in 100 years of women in the dental profession. So we are absolutely delighted to have Dr. Hoda with us today, and thank you for joining us.
Oh, thank you for having me.
We are so excited. So, very rare actually for us to find a lady in academia. And before we delve into that, we would love to hear about your journey early on and how you got into dentistry.
Oh, thank you for the lovely introduction, Nihal. Well, when I was little, I think I was probably about 4 or 5, and when you're that age, lots of people ask you, "What do you want to be when you grow up?" And I said I wanted to be a dentist and a teacher. And at the time, my grandmother said, "You cannot do that. You have to pick one." And the story goes that I actually burst crying. I was really upset that I just wanted to do two things and I was not allowed to, or they said there's some kind of rule that I cannot do that. But it turns out that you can be two things at once. Um, and yeah, I didn't want to do medicine. There wasn't, I didn't, I medicine wasn't something that I really wanted to do, and dentistry was something that I didn't quite like my dentist, and I thought that I wanted to make maybe a difference. Um, so yeah, so that's I went to dental school, and that was good. I moved to the UK. And I did my IMCLIN Dent at Queen Mary University, while doing a senior house officer job at the time. And then I started doing my PhD, and I really loved research and started to teach some undergraduate and postgraduate while I was doing my PhD, and started to do a little bit more around um, supporting different things within the School of Medicine and Dentistry as it was then. And then I got a post as the senior tutor for international students. So that was a role to support international students who were part of the School of Medicine and Dentistry, and to understand the challenges that they had as part of, an international group, really. Um, and
Did
yeah,
you
and
did you grow up? Where did you grow up? And can you tell us a
I
little bit about that?
Yeah, I grew up in Egypt, and yeah, completely different culture, different, very, very rich history, and yes, I've been in the UK for a long time now.
So did you do
So how
your
did you?
undergrad in did you do your undergrad in Egypt or
I did my undergrad in Egypt, and when I got here to the UK, I was doing my postgrads in here, and I didn't want to go down the route of the more work into I think um, the international qualifying exams, the ORE, I think it is.
Mhm. Yes.
And I was more interested in doing, although I did some clinical work based in hospital, um, my drive was to go towards something more research based and kind of some of the non-clinical academic pathway, if you like.
Wow. So it's amazing actually. You had that clarity quite early on in your career. that you were drawn to research, and you don't get that often now
Mm,
within the
mm.
student cohort. Was there a particular experience or incident where you really felt like, do you know what, research is my calling? Or was it that little teacher in you that was kind of like, I can see myself teaching, but alongside research?
Well, it was I was very fortunate that my very early experience, you were able to do a little bit of both. So when I was doing my IMCLIN, I was able to supervise some of the undergrads. I was
Mm.
able to do my research project as part of my IMCLIN. So as part of my IMCLIN, I did my research around oral health status in children with gastro problems. So I was based with the medical team of the gastroenterology clinic once a week for a whole year, um, asking families and little children if they would take part in my research project. And that is so long ago now. And I had 110 participants. So that was a
Wow.
huge, the generosity of families with young children who had all kinds of gastric problems, from just simple ulcers all the way to Crohn's disease and ulcerative colitis. So that opened my mind to, there is a big world out there, lots of intriguing areas to explore and to investigate. Um, and and I think it was really um, amazing to find good supervisors, good mentors who saw a potential in me. So they saw something. They said, and that's where the PhD idea came from. So my research supervisor back then, she said to me, "Look, you're doing really well with your M. Clinton research project. Would you be interested in doing a PhD?" And I said, "Yes, please." She
Wow.
said,
And what was your
just
indent
yeah,
in?
just think about it." She said, "I was doing my M. Clinton in peds."
Ah,
Ah.
fantastic.
Yeah,
Fantastic. Hence
yeah,
the research in younger children.
exactly. Yeah,
Okay. And
yeah.
then how soon after did you go into the PhD? Was it straight
Straight
away?
after, so I finished
Oh,
my M. Clinton in the September, and by end of October, I started my PhD.
wow. That's
Yeah.
So,
amazing.
okay, so just to kind of talk about the pathway, and I think obviously this was going back a few years, and
Mm,
things may have changed. Some things may have been still
yes.
consistent.
Yes.
Um, so if there's anybody who's thinking about, you know what, I'm quite interested in research, or I have a curious mind and I want to explore certain things,
Mm.
they might still be a clinician and working clinically, but is it feasible to be a clinician and do a PhD alongside, or do you have to be sort of full-time into research and academia to then pursue a PhD?
Well, you don't have to be. I mean, although I started my PhD full time, I ended up doing my PhD part time just to fit around my family at the time and the needs of what I had at the time. Um, but at the moment, I've got a PhD student who's doing her clinics, 2 days a week, and doing her PhD 2 days a week. So you can do both. I think it's slightly harder when you are part-time because it can take a little bit longer because it can take you maybe 5 or 6 years to complete your PhD because it's a full-time 3 years completely dedicated 5 days a week. Um, but there are lots of opportunities where you can do a PhD and still maintain your clinical practice, or you're doing something else alongside it. Um,
How do you find these opportunities?
Check your local universities, check the local institutes around where you are. There is usually calls for funding. There are funded projects that are advertised. So you can, if you search for PhD funded projects, you get a whole list, and you get lots about microbiology and histology. You get loads of them. So my project at the time was funded by Unilever, and I did an initial interview. I did a second interview with the company present. visited them, to just align to see whether you're the right candidate. You do
Mm,
a research proposal, for example. Now we recommend for people to do a research proposal. So University of Bedfordshire, where I'm based at the moment, if you are interested in doing a PhD, you can, have a chat with a potential supervisor. They can help you to set up a proposal. And I think the key thing is funding.
Yes.
mm. Yeah.
Um, because of the length of your study, it costs a bit of money, and also because you're not going to be working full time. Um, so it's that balance to do it. But I know that I I understand that Colgate, for example, have a scholarship that you can apply to fund a research project that can go toward fees, for example. So keep an eye on research funding opportunities. What I've learned throughout my career is that nobody comes to you and say, here is a little bit of good fortune. Would you like to have it? Usually you need to knock on lots of doors. And sometimes doors will open, sometimes they will remain closed, and you just yeah, you need that resilience to actually, hear the no, because without the no, a yes will not be meaningful.
Wow, that's so powerful. And how do you build the courage to knock on those really difficult or tough doors?
Um, Look, I completely believe that we don't grow when we're resting, you know? You grow when there are something that you stretches you, something that is a little bit tough, and so when you're studying, you're being stretched. If you know it all, then you probably everybody then will be doing the same thing. If it's easy, then everybody will be doing it. And I
Mm,
think it's going back and asking the question, what do I do here to improve? So if I'm not yet ready, so say you submit a proposal and it gets rejected, ask for feedback. Ask for feedback. How can I improve it? How can I make it better? What do I need to do in my experience or my CV to make me a better candidate next time I apply, rather than, oh, that's it. I'm not doing that again. And I think we do that. You do that in clinical practice anyway. You're always seeking improvement, how I can make it better, how can I enhance my skills. So we have these abilities anyway. But I think what differentiates a good clinician from an outstanding one is the ones that can enhance the kind of the margins. And you see that in sports, for example. Yeah, you learn to run. Now you're wanting not to improve your personal best. Yeah.
yeah.
So that's the idea. I think that's how I approached it anyway. Um, so I go back and I ask more, how can I make it better? How can I improve that CV? How can I improve this submission? Um, and I think that's the only way we can learn.
How have you found engagement over the years with academia and research? Have you found that there's been consistent? Has it been getting more interest or less interest? Like what's the sort of patterns you've seen?
You mean for in research?
Yeah, so
In
for dentists who are interested in research.
I think I think dentists. I've been leading and teaching the dental education programs and the dental law and ethics program in the University of Bedfordshire for over 10, 12 years now. So I've been dealing with a lot of dentists on the other side of the equation. So now the postgrads, and funnily enough, I think a couple of years I had a couple of my undergrads, the people that I taught as an undergrad, now coming back and not being able to
Wow.
escape me as a teacher. Uh,
How does that feel when somebody
hmm,
comes back in that
I
respect?
feel very old, Tejal.
And can I just say that's where I met
So,
Hoda because I did the PG cert
yes,
of
correct.
dental education at University of Bedfordshire, which I loved, by the way. So look into it, guys. And it was a really popular course. There were loads of
hmm
people in
hmm
my
hmm
cohort. I didn't
hmm
honestly, I didn't
Yeah,
expect that many people because when you sign up to this course, I didn't know anyone doing this course. I'd never considered or thought that I'd opt, voluntarily to do a PG cert in dental education. But again, because I had that interest in teaching, I went for it.
Mm,
And I
mm,
was genuinely shocked at how many people were there in a really positive way, which was
good.
fantastic.
Yeah, I'm glad to hear that. I think yeah, working with dentists who are interested in teaching and learning and coming in um to learn a different skill, the passion to learn beyond the parts that we're really good at. Um, and how do you engage with somebody else? How do you pass on your experience? How do you feedback? How do you lead? How do you engage the other? Um, it's amazing, but I am again, preaching to the converted because those who sign up, those who are interested in the subject. But I think over the years, I've noticed that um, maybe there is a tendency that we want things quickly and we want them, we're kind of surprised when they are a little bit tough. Um, so it's almost like, I think because we're seeing more of a finished product. So, the very kind introduction, Nihal, you know, in less than a minute, you've described something that I've been working on for the last 25 years. And what people don't hear is the ups and the downs and the difficulties and the no's as well as the yes. So,
Talk to
you
us
know,
about the downs a little bit. So you mentioned about
yeah,
the no's and
mm,
part and parcel of it, especially when you're seeking funding.
yeah.
What other challenges have you faced in your career?
Okay, so you apply for jobs that you don't get.
Yeah,
Nobody brags about those on LinkedIn. Um, you submit work that people will say that's not good enough, so you've got to revise it and you've got to make it different. Um, I submitted articles before for publication that got rejected. Um, actually, we got published an article today. It's in the BDJ online. You can go and check it out. It's about defensive dentistry. It was one of
Fantastic.
my MA students. And this article, we've been working on it for over a year. And when it first went to the reviewers, it came back with loads of comments. And usually at that stage, people will say, oh, we don't have time for because you've got your day-to-day job, you've got some other things that you need to do. There isn't a deadline as such for publication. You're doing it on your own steam. And all of this is like, yeah, another thing that you need to explain, clarify, expand on to, polish the what you're trying to say to a wider audience. So I think it's that resilience of just coming back and saying, okay, yeah, I can see that that wasn't very clear, but that's why I kind of um encourage my students that you've got to have a bit of a thick skin. It's never going to be handed on a plate. And if it's worth it, you will have to work a little bit harder for it. Uh, but of course, we all get frustrated at times and things can get a little bit difficult, but it's about just learning. And of course, now I look back at some of the stuff perhaps I've done, say, 10 years ago, and I'm thinking, yeah, I think I take the comments slightly easier now than before. Before it feels like a personal
Yes.
personal criticism, but it's different because you think, yeah, I mean, I can see, yeah, I need to make it clearer or I need to get better feedback, and now uh, then you get better for it.
And how have you found, I mean, as a female in the world
Mm.
of academia, how have you navigated that challenge? Or has it been a challenge? Or has it been, okay?
I think it's always a challenge because I think when I first joined the university, when I was working at Queen Mary, and then when I'm working at Bedfordshire, initially, I was working part-time to be able to, look after my family and so on. So when you're working part-time, I say to anybody who's working part-time, I hear you. I get the frustration. You feel guilty when you are at home, and you feel guilty when you are at work because you get to work and you feel that you've missed out because the team meeting happened on a Thursday and you don't work Thursdays, and then you're at home, you feel that you're missing out because the school class assembly happened on a Tuesday and it's your working day, and you feel like you're missing out on both. Um, but I think it's just learning to live with that. it, there was no, for me, there was no other choice. And I think there was an army of people who were helping, not just immediate family, but friends, neighbors, school breakfast clubs, after school activities, holiday clubs, um, and everything in between.
Yeah, it does
Wow.
take a village to raise children. I think we forget that.
Completely,
And I
completely.
think when I see colleagues, juggling, all juggling, it's a juggle.
Yes,
That, and
it is.
especially I feel like women do sometimes shoulder a lot other,
Mm,
sometimes the mental burden of running the household as well. So they've got
mm,
it's just it's a lot, and I give, a lot of respect for people who are doing it, because, it
mm,
takes its toll and it's not easy, but I think the beauty of society nowadays is that you actually can do it, as long as you can, like you said, learn to live with the guilt and manage that aspect of it and not let that hold you back. You
mm,
can still,
mm,
wear different hats and embrace all the roles that you are privileged to
Mm.
be, to have.
mm.
Um, I just wanted to ask you about, so just following on from what Nehal mentioned, what is the percentage, roughly speaking, of women to men, or the ratio of men to women in academia?
I don't know that, but I know that it's as you get higher in kind of the grades, if you like. So if you're looking at um, senior academics, professors, and so on, if you look at that, you've got more men than women. But I think that is reflected as well in business, for example, um, with number of CEOs of companies. I think because on the whole, of course, it's different. It's not, I'm not trying to generalize, but on the whole, you probably take more career breaks, you work part-time, so you may be as qualified, but you may not have had enough, years
Under
to
your belt.
under your belt to go for kind of a top job. But I must say, because I'm part of the Faculty of Health and Social Sciences at the University of Bedfordshire. We're surrounded by amazing women because I guess in health and social care you've got more women anyway. In those speciality, from nursing to midwifery to social workers, so you have a whole group of, lots of professions where a lot of women predominantly, attracted to these services, which, you know, I think it's great. So we have lots of amazing academics, women academia.
I love that, and I think there is definitely getting, like one of our tutors who tutored us
Mm, mhm,
became a professor, and we were so proud of her. And I think, but
mm,
I haven't, I don't know the ins and outs of it, but I know it wasn't easy, and I
mm,
believe it's something you have to put yourself up for, like put
mm,
yourself, it's not something that's handed, like you said, down to you.
correct.
So if somebody has that ambition to become a professor, what
Mm.
advice do you have for them?
Um, Read a lot, ask lots of questions, and find yourself a mentor. And
Mm.
that's why I'm very passionate about mentorship. I've been so fortunate in finding amazing mentors and seeking amazing mentors throughout my career. So I will go to people and I ask them, would you mentor me? Would you, because um it's not just enough to watch somebody from a distance. You need that critical friend who will, a few steps ahead of you and can give you some advice, and will be interested in you, interested in your
Mm.
well-being and your career as well. Not everybody will be. I'm not expecting that, but I think it's find someone that you admire, you respect, and they are willing to be that critical friend. Um, and then they will be able to kind of be like, but sometimes you want that sounding board. You want somebody to say, does that make sense? Is that job worth, putting the effort and, sending an application for? Do I volunteer for this organization? And that's the other thing. It's not all about um, you know, what's on your CV from a kind of a dentistry
Mm.
viewpoint. Some of my students who complete, say, the MA Dental Law and Ethics, they will say, "Oh, I want to apply to be, to work with the GDC, or I want to apply to work with one of the, dental defense organizations, for example. What else can I do?" Sometimes what is required is that you've got what other experience have you got? Have you sat on a different board, for example, of your local school or your local college? Have you got other experience? Did you volunteer for the food bank? Do you mentor others? It's not it's not a recipe book.
Yes.
Mm.
Do this
Yeah.
and then you will get that at the end. But if you are enhancing your skills as a person, you're widening your pool of, of what you can offer, whether it's volunteering, whether it's helping your local community or doing something else, it all adds to how you are and who you are as a person.
Do you know
Enhance that job.
that really resonates? I remember when I shadowed a dentist early on when I was doing dentistry.
Mm-hmm.
I heard this dentist speak at like one of those, dental
Mm,
talks, and I just asked him, "Oh, can I come and shadow you?" And when I went to shadow at his clinic, I remember so well, and this must be like 10 plus or 15 years ago or something. He said to me, "Don't just do dentistry." He was
mm,
like, go on a business
mm,
course, learn about entrepreneurship, go
yeah.
and learn other skills,
Mm,
build your skills. And that's exactly what you're saying. If you're sitting on your local school board or you're, volunteering with your local, charity or something, you
mm,
are going to pick up skills. And I think what happens so often, and I know I've been guilty of this, I think I'm a dentist, that's it, that's it. Anything dentistry related, that's
yes.
it. But actually, there's a whole world outside that we can actually learn from.
So yeah, no
Too.
matter what you're, whatever you're engaging in or whatever, work you're doing, I think what I'm hearing is that it's so important to
Mm,
develop yourself as a whole, as an all-rounded person,
mm-hmm,
in order
Mm.
to excel or progress in anything, um, because yes, like you said, all these experiences add up, all these skills you add up, you learn so many different things that just elevate you bit by bit
mm-hmm,
to go forward
mm-hmm.
in whatever it is that you want to do. Um, that's really interesting because yeah, actually sometimes you
Mm,
just think, okay, if I want to um, go further along in education, then I need to do more publications and presentations
Mm,
and
mm,
research and things, and that's probably one small element, but
yeah.
not the be all and end all.
Yeah, and I agree. I think think about, you graduate, say 22, 23. Okay, you do 20 years of dentistry and you're still mid 40s and you still have another maybe 20 more years to do drilling, fillings, and all the wonderful things in between. And I think sometimes people come to a point where they think, I am really good at this now. I know what I'm doing. I'm not questioning it anymore. I'm consciously competent. I understand what I'm doing, but what's next? What can keep that excitement, that passion, that
mm,
drive to carry on? And you need to find that. You need to find that for yourself. You need to find that kind of that thing that keeps that sparkle. So that could be, you're volunteering or you're studying something else or you're working towards something else to keep you excited about the day-to-day job. And I
So
think that is really
important.
important.
So important. I'm so glad you mentioned that. What is driving you, Hoda, right now?
Ah, I tell you what, I feel like today we had our graduation day, and it's very much one of the best days in the academic calendar for me. It's making a difference. It's inspiring others. It's supporting others. Um, and you know, seeing that sparkle, that kind of igniting that love, that kind of that fulfillment that you can give to someone else. And just feeling, I'm doing something I really love, and um, and just seeing that difference that makes to my students. I think that's what else can I want, really?
Oh,
Wow. You can really sense the passion in that. And it's actual, we can tell it gives you genuine joy, Hoda. And having been your student, I can vouch for that as well.
Yes, good.
Um, so no, thank you. Thank you for being so open and sharing your journey so openly, because I honestly think research isn't talked about enough. And
Mm,
we need it in our line of work, and especially whether it be clinical research, but also non-clinical research as well,
mm,
about
mm,
behaviors of mentorship and feedback and how you take feedback. And it
mm,
was really interesting. Tej and I were once having a discussion, and we were like, the way someone takes feedback is actually a really good indicator of their like personality.
mm. Yeah, and I guess you mentioned about is the passion. I think for me, it's the connections. I think dentistry is a tough business. Is really a tough clinical practice is really tough business. Think about it. The first thing patients say when they walk in is, I don't like coming to see you. And you end up having almost a conversation with yourself, because if you're doing a good job, the patient is sitting there with you working inside their mouth. So you don't have that interaction. So it can be very lonely. It
Mm,
can be a lonely business, really. And it's the connection that that is really important for me anyway. So the connection with colleagues, the connection with students, the kind of the idea that everyone matters, every individual matters, not just the mass, not just the total data, but everybody. If you're making a difference to someone, that's really the drive. Um, and yeah, just seeing that difference, just seeing that difference.
it's
wow.
really wonderful that you've actually recognized what your interests are, what your strengths are, and you've kind of, you've been true to yourself or true enough to yourself to walk that path. I think there's a lot of us sometimes sort of know we are doing work, we're doing good work, but we know that it's not quite aligned
Mm, mm,
to, who you are or what your genuine interests are, but you're
hmm.
doing it because multitude of reasons. It pays the bills and
Yeah.
and you've got responsibilities and so you keep your head down and keep going. But I think it's really important sometimes to, take a step back and reflect to be like, am I doing what I feel like I'm put on this earth to do, or am I pursuing my calling? Or you
Mm,
kind of know it's an internal feeling, isn't it, that what you're doing, whether that's aligned to your higher purpose or your
hmm.
true
Hmm.
um what your true interests are. But like you said, also it's sometimes quite normal to have a combination of varying interests as well. And how can you marry that up in
Hmm.
or incorporate those elements in what you're doing and be able to still stay true to yourself, but not necessarily have to pick one or the other, or
Mm,
still do those
mm.
different things. And
Yeah.
and I think I'm a massive advocate for doing these other things outside, maybe your day to day,
Hmm.
just that's important to you, or that feels really, that fuels you because it's just brings so much joy. And you should be making time for it. It's really important. But one thing I love about education is the curiosity that of your mind, like the mindset you need to adopt when you are either critically appraising something or you're investigating something or you're looking into something. And I
Mhm.
sometimes feel like that curiosity can be diminished when you're sort of on autopilot.
Yeah. Yeah.
What comments do you have with regards to curiosity and how to keep that um, keep that sort of alive?
Wow, that's a big question. Um, I think it's the whole the I think some of the challenges that it kind of in medicine and in dentistry we are being taught um about the right way of doing things and the wrong way of doing things. So you on the whole there is a black and white kind of on the whole. So you learn your treatment plan, you diagnose something or you miss it completely. It's either there is carers or there is not. So so I think so when it comes to the non-clinical aspect of remaining curious, remaining open-minded about that there may be a different way of giving feedback or leading a practice or managing people or mentoring others. Um, Sometimes because it's been drilled in us about how to do things the right way or the wrong way, you that sometimes can impact other sides of our lives that is not really black and white. And you can live with both at the same time. And I think sometimes, I talk to colleagues and I talk to students who are just really giving themselves really hard time for not knowing what's their purpose or what's their high, and that's okay. Not everybody will find that thing that makes them, having that fuzzy feeling inside. And most of the time, you don't have that fuzzy feeling because it's a Monday morning and you've got a ton of stuff to do. It's just, it's the something that may be small or big that keeps the spark in your eyes, that keeps you going, um, and that keeps that curiosity. And it could be just, you know, feeling that fulfillment because you are just doing an honest and a good job, the best that you can, or that you're reading the best, the latest articles, that you're volunteering, you're serving others, you're helping others, you're mentoring others. I think it's for you as an individual to find that.
Hmm.
Um, and that can also change as you get older and as you get better at things, and for other things you lose a little bit of interest. So that's okay too. It's not like something that will remain static throughout. Um, I don't know if that answered your question,
Yeah, no,
Dad. I don't
thank
know.
you.
Yeah.
No,
I
thanks.
think you're right. I think a lot of people put pressure on, I don't know my purpose.
Hmm.
But I think sometimes it's not this big shiny thing. It's
No.
the small little moments that you find pleasure in
Yeah.
and
Yeah.
actually that keep you going and drive you. But thank you so much for sharing. And as we wrap up, I would love to do what we all do with all our guests and ask you if there was one piece of advice you would give our listeners, what would that be?
I would say be kind to yourself and just keep knocking on different doors. Um, and if at first you don't succeed, try again.
That's wonderful. That's brilliant, brilliant message to conclude this episode. Thank you so much
Thank you.
for joining us and having this wonderful conversation that hopefully will, never know who's gonna listen and who will inspire.
Thank you. Thank you for having me.
Our pleasure.
Thanks for tuning in. If you enjoy this episode, don't forget to hit follow on Spotify or Apple Podcasts and to hit subscribe on YouTube so that you never miss a new one. It really helps if you rate and review the show, and if you found this episode valuable, share it with a friend, family member, or colleague. We appreciate your support and we'll catch you next time. Bye bye.